There's a lot of people who have a deficiency of stomach acid that creates all sorts of issues. There's a really simple test that you can do to figure out if you potentially don't have enough acid in your stomach. I'm going to show you that. In fact, I'm going to show you 3 different tests. Okay. The test is called Riddler Gastric Acid Reflux Point Test. And so since your stomach is kind of right up underneath the lower part of the sternum and kind of going a little bit down below that, what you can do is you take your breastbone, okay, the bottom of your breastbone where it ends, okay, there's a little piece of cartilage there, and you go 1 inch below that, okay, and then you go 1 inch to the left, and you'll hit your rib cage right at that point. That is the location where you press into the rib cage and just see if it's tender. If it is overly sensitive, it could mean that you have a deficiency of hydrochloric acid. There's 2 other tests. One is a baking soda test. You get some regular baking soda in the morning on an empty stomach, and you take 1/4 of a teaspoon in a glass of water, like 8 ounces, dissolve it, drink it down, okay? Now what's gonna happen if you don't have enough of this hydrochloric acid in your stomach is you'll start burping, okay? So if you start burping within 1 to 5 minutes, then chances are you don't have enough acid, because baking soda is alkaline and it's going to start neutralizing the acids. But if you have enough acid, you won't have this burping. And then the 3rd test you can do is just to take some betaine hydrochloride, which is the kind of the antidote or remedy for low stomach acid. And then with a meal, take one right before you eat something, chew the food, good, take another one. And then what you do is you'd keep adding a little bit more of this betaine hydrochloride with each meal. Okay, so what's going to happen is if you have enough stomach acid, okay, and you drink this, it's going to cause you to burp within 1 to 5 minutes. Okay, so if you're burping, that means you have enough stomach acid. Okay, if you don't burp, that means you probably don't have enough acid. So those are the 3 tests that you can do to kind of figure out if you have low stomach acid beyond the symptoms of low stomach acid, which I want to get into. And the symptoms would be like indigestion would be number 1, gas, bloating, acid reflux, GERD, anything that kind of reflux into your esophagus would usually mean low stomach acid. But relating to this topic, I want to talk about another thing that's extremely common as we get older. It's called atrophic gastritis. And this condition is like in 50% of the population over the age of 55, or a version of it, okay? Because sometimes it could be asymptomatic and you might not even know you have it. But because it's so common, you should be aware of it. So here are the symptoms. You start getting atrophy of the lining of your stomach. So your stomach actually starts to shrink. Now, the cells in the stomach also start to shrink, and those cells make hydrochloric acid. So guess what you're going to get? You're going to get lowered amount of hydrochloric acid. So this is one of the big reasons why we start losing our stomach acid as we get older, just because the cells start to shrink, okay? And a certain percent, I'd say 10% of people who have atrophic gastritis have it because of an autoimmune disease, okay? So that's another aspect to this. So there's chronic inflammation involved with this. And so we have low hydrochloric acid, but you have to also realize that the same cells that make hydrochloric acid also make something else called the intrinsic factor. And what's that? That's this protein that gets released by those cells, travels down to the small intestine, and connects up with your B12 to allow for absorption. And if you don't have enough intrinsic factor, you're going to be deficient in B12, which you're going to notice fatigue, anemia, neurological problems, lowered cognitive function, and there's a lot of other symptoms that can occur from a B12 deficiency. You're also going to be low on folate. Now, as I've been doing deep dives into DNA, boy, across the board, so many people cannot absorb B12 and folate. Okay, so those are just 2 nutrients that a lot of people need more of. Also, without the stomach acid, the person's not going to be able to absorb iron too well. So they're going to be anemic from an iron angle. So we have anemia from B12 and anemia from iron. So you're going to be kind of lethargic, kind of tired, dragging, loss of energy. You also will lose the taste for red meat, the tolerance of eating meat. Maybe you can have a little bit, but too much just does not digest. That's a classic indication that you need more hydrochloric acid.